Biggest problem that we have at the moment is the people who are sitting at home in isolation, not asking for help. What are we going to do for those people? We need to reach them.
Because there's no shop, no pub, no post office.
There's
nowhere for them to meet and have a chat, and I think that's vital, really, isn't it?
The old Mehel spirit where people came together, whether it was to do harvest or haymaking, the rural post offices, we know it in our own case, and after the rural shops, gone. And
we need to reconnect people with other people. The person who's sitting at home alone, connecting with nobody, we have to reach them. So we have to go to where they're at and then invite them in.
Ershka, Kele, Amwarn Nadina, which basically translates, in each other's shadow we all live. No man is an island.
I think people really do need to talk. I remember one particular instance that I know of, that a lad left a diary entry, and it was mentioned that he was often in a crowded room at home with a lot of happy family members, and he never still felt so lonely. So it can be just there sometimes that you don't know what's going on necessarily always around you.
Suicide, it's in every single community now. But it's not something that we must walk away from, or something we must say, lads, it's awful. It's something we must tackle, and we must tackle together.
It's reminding people of their strengths and their resilience. And when they can't find that themselves, they reach out to the supports that are available.
It's good to talk, but not only is it good to talk, it's good to listen, it's good to watch, it's good to observe. And I think every one of us could possibly, if we do that, we may help somebody through a time of need.
So while the vacuum has been created with the pubs gone and the cordial culture gone, we must now replicate or replace it with something else.
And on the one hand, it's sad that it has come to this, and on the other hand, isn't it great that we're doing something about it?
In response to a number of tragic incidents in the area, the HSE would have approached us in response to an identified need, and to look at, were we interested in coming together to work on a project to put rural community health workers into the rural areas of North Cork.
Well, I think in terms of collaboration, it was important for us to involve the partnership groups, because you're the ones that are close to the people on the ground, or close to the communities, and you know the communities.
Yeah.
This is something we can't do on our own.
Milford, Dromina, Shanballymore, Liscarroll, Churchtown. It's lovely to come back and visit these small, rurally isolated communities and get to know the people, the community councils, the leaders of groups already in communities, and introduce myself and be a familiar face on behalf of Ballyhowra and the activities that Ballyhowra can offer in these communities.
So Jackie's role is linking in with rural communities in North Cork. So we have staff in the communities, like we've an office in Mitchelstown in County Cork, an office in Charleville, County Cork, and there's other staff in those organisations. So now we've the additional resource of Jackie just working in community health, community mental health. But she's able to work alongside the other workers working on the SICAP programme.
That's right.
Working with the links into the community.
And it's very strategic then, from our point of view, having that direct link into the rural community.
It's a big partnership and collaboration, a network of support.
Shanballymore is a very small little place. We've no pub, we've no shop. No post office.
Like the post office, well, that's where people go to collect their pension or post a few letters or whatever, and that's where the chat happens, isn't it? So, I mean, when the post office has gone from...
It wasn't just the post office service, it was the social.
Exactly.
That was taken.
That connection.
Yeah.
My brief is to create activities for people to attend, particularly where there isn't activities happening. I'm 1 year in now and seeing similar faces at the men's sheds or the women's groups.
Stretch through your fingers,
or in the community activities. We talk about mental health or recovery or women's health, or with the men's sheds, it's usually history or something that we've talked about, which is a form of well-being too. We held the Hello, How Are You coffee morning And that was a great opportunity, post-COVID restrictions, to come back out in the community and just have a simple cup of tea and say to everyone that we meet in the centre or in the community hall, hello and how are you?
There's people that hadn't seen, other people from one end of the week to the next, and they come down, they sit, they meet their neighbours, people that haven't seen in a long time, just have a cup of tea, cup of coffee and a chat, and then someone might bake, and that's really it. It's just nice social, people interacting with each other.
Obviously, if anybody had anything they wanted to talk about that was deeper, we were there to be able to listen.
I believe that if we have a powerful foundation to our communities where there's a listening and a hearing facility available to people, many people contemplating suicide would never get to that stage, because they would be able to deal with it before it became a crisis.
And again, sometimes when we do feel lonely, we do need to turn to ourselves. So it sounds corny, it sounds uncomfortable, we all uncomfortably laughed then when we had to give ourselves a big hug. But honestly, the more we practice this self-love, this self-care, it becomes part of our second nature. It's so important for our well-being, our self-esteem. Support.
You have the buffer form.
That down there won't be interrupting anybody. I have to go to the other side to hold that. What side are you coming?
Yeah, go take no.
Do you want to go in here?
The garden project was 8 weeks in the spring and 8 weeks in autumn, and now we're going to attempt for the first time ever a full year round of activities for the gardening group. So it might not always just be gardening. We hope to do art and craft in the Christmas period, and then hopefully in the new year do something like cookery, maybe dance. Pauline, if we did cookery in the new year, would you be interested if we got
We could do that too.
There would be households where people are usually at home during the day, kids are gone to school, so I would like to get a lot more people engaged out of those kind of residential areas.
This is one of the newest areas that we put in. This was all overgrown with like ornamental trees and stuff. So we kind of decided to put in kind of a permaculture inspired food forest here and kind of have as little maintenance as possible.
Go in to see it.
They do. And you can, here's a
You know, you create an activity, you create a space where people can come. They are happy places to be yourselves, you know, and just to relax and socialise together as well.
Do you see it? You're not getting any. It's great for me, for my mental health, and I love pottering around out the back with the pots. I don't have ground, I've all concrete, but I've all pots, and I love planting. It calms you down, it gives you're more at peace. Do you know, if there's something going on in your head, and you go out in the backyard, out in the fresh air, and you're at the pots, I think it just calms you. And you also get a sense of inspired by plants that grow, that you did it. You know, that kind of way, that they're grown, I planted them.
Last week I delivered a women's health workshop, so that was a great opportunity for us all to sit around and talk about women's health as a group of 7 or 8 people.
Your own peace of mind and your own mental health, like, you know, what's going on at home, you leave at home and you go up there and you have a cup of tea and you have a chat.
Connectivity, friendships, rural has been emphasised a few times. You know, rural communities, how precious these are, to try and keep rural communities together and caring for each other and being able to support each other.
Networking with communities. So collaboration is the key to all this, and working together, all the local development companies working together, working with the HSE, working with other professionals in the community throughout North Cork, and it's great to the buzz and the interest around it and how that will work going forward in the community.
The men's sheds that I support, or the women's groups that I would attend, weekly activities, being social, being connected, but also at the same time having the opportunity to talk about women's health or men's health, or doing some art and craft while we're at that. Ensuring that the rural communities in North Cork are suicide safer places to live in.